So let's go through this. From as far as the cost, the patient, that the patient pays for the physician time. Well, it depends. There are some situations in which the patient sees a physician and they don't pay anything for the physician time. Sometimes they do. So it really depends upon the context in which you have to determine who pays or who does not pay. For drugs, for example, in a lot of countries for HIV treatment, the drugs are provided for free to the patient, so they don't pay anything. But in some situations, like in the US, we do have to pay for HIV-related drugs. So again, it depends upon the context. Administrative costs, normally the patient doesn't pay. It may be wrapped up in some copay, but in general, they do not. Patients lost productivity. The patient has to pay for that because they're not able to work or earn money. They lose some productivity related to their job, especially if they're self-employed. Patient's travel time, yes, the patient pays for that. And any time off that the patient has to take, either to travel to work or to stay at home, the patient pays for that. So what about the Ministry of Health? So the Ministry of Health definitely pays for the patient's time. They usually pay for the drugs, especially in most countries, but there's situations in which they don't pay for the drugs. Administrative costs, yes, for sure. But as far as the patient's productivity loss, no. Patient's travel time, generally no. And here, my insurance will pay for some of my travel expenses to see the physician. So again, it depends upon the context in which we're looking at. But the Ministry of Health does not pay for the time off. So from a societal perspective, as I stated earlier, everything gets included for the societal perspective.